Today we're going to do the complete adolescent assessment. Uh, Hi, Christina. I'm Kathy.
Hi.
I'm your nurse today. Uh, this will probably take about 20 minutes, and I'm going to do a complete head-to-toe assessment. So if you have any questions along the way, just ask.
Okay.
Okay, so I've walked in, and, first thing I do is I notice that Christina is cleaned and well-groomed. We have got her height and weight. Her height is 5'1", and her weight is 95 pounds. Her BMI would be 19. Let's go on ahead and do the vision test. I have the Snellen chart on the wall 20 feet away. I'm going to have Christina use this card to cover one eye. And then I'm going to have her read the smallest line that she can see.
Cover my right eye.
Cover your right eye.
Okay. D-E-F-P-O-T-E-C.
Okay, good. Now cover your left eye. And again.
D-E-F-P-O-T-E-C.
Okay, so I see that Christina's vision is 20/20. Okay, you can hand me your card. Now I'm going to have her read from this book. She should be able to read at about 12 to 14 inches away. Yeah.
Start at the top.
Start wherever you want.
Okay.
There might be easier.
The DNA in chromosomes contains genetic instructions that regulate development, growth, and the metabolic activities of cells.
Okay, good. So reading that from 12 to 14 inches away scores her a 14 out of 14 on her eye test, which is perfect. We've done her vital signs. Her temperature was 97.6 orally. Blood pressure 102/68. Heart rate 68. Respiration 16. And her SpO2 is 100% on room air. So all of those are very good vital signs. Now we're going to do the head. Oh, wait. Let's check her cardinal field of vision. So I want you to track my finger. Okay, perfect. So no strabismus, no nystagmus. I don't see any meiosis or ptosis of the eyes. There's no drooping, no abnormal movements. First thing I notice about Christina's head is that it is nice and round. Sits perfectly on top of her shoulders. Okay, there's no lumps, bumps. Don't see any rashes. No tenderness. Have any pain or anything anywhere where I touch? Okay. I don't notice any pesticides. Looking at her face, I see that it is symmetric. She has an eye on each side. Her nose and her mouth are midline. No drooping or anything. Her skin is uniformly tannish pink in color. It's warm, dry, intact. Turgor is good. There's no lesions, birthmarks, edema anywhere. The hair had an even distribution, no alopecia. The eyes, I'm going to shine this light in your eyes. Okay, her pupils go from about a +3 down to a +2. Okay. Now what I want you to do is I want you to Look at this up close. And then I want you to look off into the distance. Okay. So her pupils do acclimate to the distance. They're equal round reactive to light. Her level of consciousness, she's alert and oriented to person, place, time, and event. Mood, she's comfortable, relaxed, and cooperative. She interacts pleasantly during the examination. Her thoughts are coherent. Remote and recent memories are intact. And to check that, I would ask, what did you have for breakfast yesterday morning?
Hash brown, eggs, bacon, and sausage.
Okay, so that good. That checked her recent memory. Now, can you tell me, who was your first grade teacher?
Miss Stamper.
Miss Stamper. Okay, so that checks the long term or remote. Now a little closer here, we're going to look at her ears. Put your hair back. Okay, and I see that her ears are symmetrical. They line up evenly on each side of the head. They're flexible. The color is consistent with her facial skin. I don't see any lesions or edema there. I would use my light and I would look into each ear, my otoscope, look into each ear, pulling the pinna back, and I would be able to see the cone of light. I would do that on both sides. It should be a pearly gray in color. I would then go on ahead and do the Weber and Rhine test to check her hearing. So with the Weber test, I have the tuning fork, strike it against my hand, and place it here on her mastoid bone. And I would ask her to let me know when she can no longer hear that. And once she tells me she can't hear it, then I would bring it and put it out the side of her ears. I would do this on each side. And a normal result would be 2 to 1, meaning that she could hear it twice as long on the mastoid bone as she can with the air conduction beside the ear. Then the Rhine test, again, the tuning fork to the top of the head here, and she should be able to hear the vibrations laterally. So on each side, she should be able to hear those vibrations. And then we have a whisper test that we're going to do. I'm going to stand behind you and I'm going to whisper 3 letters and or numbers, and I want you to tell me what you hear, okay?
A, B, C.
Okay, good. Now I would do that on both sides, so I don't notice any hearing loss of any type. Okay. Her nose, I'm going to check up inside of it with my light. Okay, septum is nice and straight. There's no drainage, no redness inside the nostrils. The mucosa is red, smooth, and moist. The middle and inferior turbinates are red with no polyps, swelling, or pain, or edema. I'm going to check your sinuses. Feel any pressure when I push?
No.
Okay, good. What about up here?
No.
Okay, so no pain or pressure whenever the frontal or maxillary sinuses are palpated. With her mouth. All right, open your mouth and say ah. Big and wide. Okay. And also while I'm in there and have her doing this, I'm looking at her teeth. Okay, her lips are pink, soft, and moist with no cracks or edema. The buccal mucosa is pink, smooth, moist with no halitosis present. Her teeth are white, straight, and evenly spaced. She has an age-appropriate number of teeth. All of her teeth are well adhered to the gums. The gums are pink and with a stippled surface. The margins were tight, well defined, no swelling, retraction, or bleeding. The tongue was rough with a pink dorsal surface. The ventral surface was smooth. Saliva was present. There were no white patches anywhere in the mouth or on the throat area. Floor of the mouth, no malignancies, white patches, nodules, or ulcerations. The roof of the mouth is hard and the soft palate is intact. The uvula is fleshy, midline, and rises with a soft palate when she said ah. The tonsillar pillars are +1. They're visible. Let's see. So now we're going to check the neck. We're going to check the range of motion. Can you turn your head to the left? Okay, good. About a 45-degree angle to the right. Again, about a 45-degree angle. Have any pain or anything when you did that?
No.
Okay, bring your chin down to your chest. Good, and all the way back. Okay, any pain with that?
No.
Okay, and I should have been feeling to notice any crepitus. Okay, and push against my hand. Good, and again. Good. Push down against my hand. Good, and back. Okay, she has full range of motion with no weakness. All right. Upper extremities. Oh, we need to do the lymph nodes. All right, so I'm going to palpate her lymph nodes here. Do this on both sides. And I don't feel any edema in those lymph nodes. Okay, so upper extremities. Can you lift your arms up in the air? Okay, hold them out to the sides. Okay, can you lean forward a little bit? Okay, now take your arms and bring them back. Okay, good. So she has full use of full range of motion in the shoulder areas. Squeeze both my hands. Good, equal strength bilaterally. Okay, check your pulses. I'm going to check the carotid pulse first. Two plus and strong, regular. Alrighty, I'm going to pull up your sleeves. And we're going to check the brachial pulse. Okay, both of those are 2 plus regular. I'm going to check the radial. Again, 2 plus regular. So that's as far as the pulses on the upper body. I'm going to listen to you. I'm going to listen to your lungs first. And I want you to take a deep breath whenever I tell you to. But if you start to feel dizzy or anything, just let me know and we'll give you a break. My patient would be in a gown, and I would have her drop the gown so that I'm not trying to listen through the clothing, because that can cause a little crackly sound. Okay, big deep breath. And again. Now I'm going to just listen to your heart, so just breathe normal. Okay, and now I'm going to listen to your belly sounds. Okay, and now I'm going to listen to your lungs on the back side, okay? Big deep breath. And again. And again. Again. Okay, good. You can sit back. Lung sounds were clear anterior and posteriorly in all quadrants. Vowel sounds were active times 4 quadrants. Heart rate was regular. No S3 or S4. Okay. Again, she would have on a gown, so I would look at her skin on her back, and I would see that it would be smooth and firm, no excessive dryness, no skin irregularities. Temperature would be warm. There would be good turgor. She has no pruritus, rash, or lesions. Musculature is symmetrical with no retractions, pulsations, tenderness, bulges, depressions, masses. Paravertebral muscles are symmetrical, firm with no muscle spasm, tenderness, or masses. Her trapezius muscles are symmetrical, firm, no muscle spasm, tenderness, or masses. And again, also with the sternocleidomastoid muscle. So to assess all of these, I'm going to pull your hair over to the side. Okay. And I'm just going to touch. Okay, no pain anywhere. Okay. And while I'm also doing that, I'm going to feel her C-spine. I feel the spinous process. Nice, bumpy. I'm going to go on down the thoracic. Okay, and the lumbar. Okay, her spine feels nice and straight. We'll investigate that just a little bit farther by having Christina stand up. Okay, and turn away from me. Okay, now I'm going to have you bend over and touch your toes. Okay, visual inspection. I see your spine is nice and straight, and the lower part of her back does pop out whenever she bends over. It gets that convex look. Okay, stand up. All right, and she stands up. There was no crepitus or anything there, but the lower back again goes into a concave shape. Okay, you can have a seat. Back again to the anterior chest. We've got the suprasternal notch, this little U-shaped area right here. Just a little depression, no bulging or anything there. On down the sternum, it's hard and flat. Any pain when I touch?
No.
Oh, okay. The sternal angle, I would have her lay down, and I would measure with a ruler and straight edge. And the sternal angle would be at about 2.6 centimeters below the suprasternal notch on her. Her thoracic muscles and bones are symmetrical with no retractions, pulsations, depressions. Okay, now if I could, I would have her lay down and I would be assessing her PMI, point of maximal impulse. And that would be just under her left breast area. I would see or feel actually a gentle tapping. It'd be barely palpable. I can do it while she's sitting up. I'm just going to touch you a little bit. Feel right in here. Okay, I'm going to look at her jugular veins. These are here in the neck. Okay. Right here. Turn your head this way. Okay. I don't see any distension. They fill with jugular veins. They fill with expiration and decrease with inspiration. Again, I would have had her laying down, and I would be able to estimate her jugulus venous pressure, and we would have about a 1 centimeter. The heart, we palpated the apical pulse. We listened to her heart in the supine and the left side position, and all of her numbers were around in the mid 80s with no S3 or S4. Have you had any change in your appetite or any abdominal pain, nausea, vomiting?
No.
Okay. Do you poop every day?
Yes.
Okay. And no difference in your poop or anything. Her abdomen is flat. It's symmetric bilaterally with no bulges, masses, lesions, or scars. The umbilicus is midline and inverted. No hernia present. Bowel sounds were active in all 4 quadrants. There were no friction rubs, venous hums, bruise. I'm going to let it sit up straight for me. Again, I would have her laying down, and I would be tapping here to help me get an idea of where her organs are. Okay, we have resonant sound over the entire abdominal area except for this right, or the left upper quadrant. Okay, she had no guarding or anything. All right, the feet and legs, the skin is bilaterally pink and warm and dry. There are no viscosities, bruising, or rashes. I don't see any abnormal hair loss on the legs, which could indicate a problem with her vascular system. There's no swelling or pain. I noticed Christina when she walked in, her gait was smooth and regular. Her arms swung opposite the legs as she was walking. She had full range of motion in her legs and feet, no crepitus or pain, no edema there. Okay, so we are going to check her pulses. I've already done the upper body. Now we're going to do the lower body. Again, Christina would be laying down. So at this point, I would check her femoral pulses in each side. Thank you. Okay, we're going to check her popliteal. Those can be a little bit hard to feel. You can have your patient kind of bend their leg a little bit. Makes it a little bit easier. Okay, we're going to check the dorsalis pedis. And the posterior tibial. We're going to do on each foot, each side. Okay. And that is also at the same time when I would be checking her skin temperature and looking for any rashes instead of doing everything as a step by step. Have you had any falls lately? Okay, good. That's another indication that gait is good. Okay, now we're going to just do neurologic area. And I'm just going to be touching you. I want you to close your eyes, and I'm going to be touching you at different places on your body, and I want you to tell me where I'm touching you.
My left arm, right hand, forehead,
Okay.
my left shin, my right thigh.
Okay, good. So she doesn't seem to have any sensory loss. And she can feel I'm touching her everywhere. Okay. Now, I'm going to take your hand, and I want you to close your eyes again. And I want you to tell me which direction I'm moving your finger.
Up, to the right, to the left, down, up.
Okay, good. So we would do that on her fingers and her toes on both sides of the body. Okay, we would use the reflex hammer and check her reflexes. We would do the brachioradial. We would do the triceps and the patellar. That's okay. We're not really going to do it because I don't have a hammer with me today. The Achilles and the ankle clonus. And with each of those, we should get a little short jerk after they've been hit with the reflex hammer. And we've already looked at the spinal area. We palpated the neck, cervical spine. There were no spasms, tenderness, or masses. She didn't voice any pain. Didn't feel any crepitus. Notice that the spine is straight with no evidence of scoliosis, kyphosis, or lordosis. She was able to touch her toes at a 90-degree flexion with no problem. And that concludes our complete adolescent assessment. Christina checks out fine. Thank you.